Welcome back to the Brooklyn Cafe on a Foundation Fun Slacker Friday. We're talking business referrals and we're putting Dr. Lee on the spot, but I'm making it a little bit easy. Because yes, a lot of business and clients and relationships grow through referrals. There are some that don't, that people find you, they look in a chamber book, they look through somebody else, you see a website, and they call you out of the blue. But then you don't know, like you see 10 glass companies that come in your mail, right? How do you know which is the right one? Unless you say to me, Jeff, I had this great glass company that installed my shower doors. They're great, it lasts, they come out, they fix it, and you go, okay, here's a great referral. Same thing for medical practice, especially for medical practice, right? Because now your health, and by people are thinking acupuncture, it's a little off kilter from regular medicine. Can it help? So you have a referral story?
Yeah. So let's talk about like eye problems, like glaucoma. And so this lady, she is in Boston. She had laser surgery, and her pressure goes normal is from 15 to 20, right? And this lady pressure goes up to 70, and then she's very likely to be blind within a few days. So she tried so many eye drops, and then I did acupuncture 3 times a week for 2-3 weeks, and then the eye pressure become normal. And then later, she just referred so many people with glaucoma problems, and it's very common now. So once this patient comes with the referral story, and they usually kind of trust you, you gain 30% of placebo effect, and then they stay with you. And once they get here, they're relaxing, and that's the first step. Their stress level goes down, and then the eye pressure will go down. And then you use acupuncture and acupressure and show them how you can normalize the pressure and protect your vision. So the referral by people is a very powerful tool to grow the business.
And it may start with one. So the patient referred someone that had glaucoma problems, and you work on their eyes, and next time they come back, like, my shoulder hurts.
Yeah.
And I met you through referral.
Yeah, I think.
Let's hear the story.
I met you through referral. We had Dr. Lynn on, Lynette, and she brought you with her, and you treated Freddie on the floor here. He laid on the floor, you put needles in his feet. And this has been over a year now, and it's been truly amazing. But we started with one thing. It's women age. We have our little issues. And next thing I know, I've had 20 needles in me every time you come down here. Seriously, She counts them. She writes on the paper how many she needs to remove. But it started with one thing, and then it's my elbow, and it's my shoulder, and then you touch my knee. And I say to you, how do you know? But it's the trust factor, right? I trust you. I know I feel better. I know I get a lot more done after I see you because I've got tremendous energy. And now we grow this platform. So from that one referral, I've seen you. We reach 60,000 people a show. And this is a huge referral because she's the best. Dr. Lee is amazing at Boca Raton Acupuncture Clinic.
Now I'm a little interested in asking you, what is this placebo effect? The 30%.
The placebo effect is like for instance, even for morphine, like this person have the surgery, right? And then they're gonna give the painkiller, morphine, and then they compare 2 groups. One group, they just put the morphine in a pump. But the other group, the doctor will go to patients and saying that I'm going to inject this morphine to you, and then the pain level is dramatically decreased comparing the one just had a pump and lying down there with the IV. So the 30% placebo is like psychologically you relaxed and you trust this person. And so we even did it for a cancer patient. Like I used to treat a cancer patient in China, and you use morphine for a period of time, and then it stopped working. The pain level just go up, and I would say, we're gonna give you a new medication which is specifically for this pain, and then it works for a few days. So 30% is a huge percentage.
The trust factor.
Yeah.
Which is interesting because I think in all business, this goes back to you're working with kids and families, and we're going to talk to Bill as well. It's the trust factor. Who are you putting your life, your children, your families in front of? For health, to grow business, and we all need money. We need to grow our business, to keep our kids off the streets. It's trust. It's building those relationships face to face. It's networking. Everything happens to be, and it's trust. But I know you also wanted to talk about glaucoma before we get into more relationships.
Yeah, the glaucoma happens in old time to like people 60 years above. That's usually 1% of the population.
Except me, and I had double eyes.
Yeah, the eye pressure. But then there's also normal pressure glaucoma. So that's very dangerous. Your pressure is normal, but you have the vision, usually peripheral vision damage without you knowing it, because you can compensate to a certain degree. And once you find out 45% of optic nerves already damaged. So going to see a doctor to check eye pressure is just one part of it. You also need a vision field checkup, and that will show you if you do have glaucoma. So glaucoma have different kind. There is a chronic normal pressure glaucoma. There is an angle closure glaucoma, which is the most dangerous one because it suddenly happens within a few days. You can lose your vision, and that's irreversible. And then it also have congenital glaucoma. The baby will born with the problem with the iris with the cornea. There's an angle, and that angle was closed or half closed. So the fluids in the anterior part of the eyes cannot drain into the right system. So it's accumulating in the anterior chamber of the eyes, and that will increase the eye pressure and damage optic nerves. So once the optic nerves are damaged, it's usually irreversible. So how acupuncture can help this condition? First, acupuncture speed up the circulation here, so you can relax the muscle instantly and the drainage will get better. But if you have the angle closure, the angle is anatomically half blocked or totally blocked, then you have to go to surgery, go to medical doctor. But if it's just chronically normal pressure glaucoma, it's the best way to use acupuncture to improve the circulation, relax the muscle, reduce the inflammation. The most important thing is the stress. When the stress level goes up, the cortisol goes up, and your eye pressure can go up. And that's the acupuncture can bring the stress level right way. Also for inflammatory problems in the eyes, acupuncture can balance your immune function. So to prevent inflammation, infection.
How does it balance your immune system through your eyes?
So
where do the needles go? I mean, I know where they go, but I don't want people thinking the needles are going in your eyeballs, right?
No.
So where do you place the needles?
So usually like around the eyes, like this point, and then the lower
By
point
your eyebrow.
here.
Oh, yeah.
Yeah.
It's a little
Around
sensitive.
the
You have to
eyes.
deep breathe first.
Yeah.
Yeah.
Uh-huh.
So for different eye condition, there's different points. Like this point is not good for the dry eye because it has anesthetic effect, but it's good for lower the pressure. So the local point and also hand and feet, and that will clearing up the heat inside of your body, reduce the inflammation, and so your immune function will not be hyperactive. So drinking coffee is good. It's good for your brain, but drinking too much can make your immune function hyperactive. That's why so many people have autoimmune disease.
Really?
Yeah.
What about drinking beer?
Moderation, right?
I don't know. Doc, how many pressure points does the body have?
Acupuncture point in regular is like around 400.
Okay, and you're familiar with all of them? Most of them?
Yeah, most of them, not all of them.
Is everybody's points different from one human being to the next?
We use the anatomical structure, like this is the end of the eyebrow. So we always have this structure, your own structure, to show where is the point. Like this point is on the orbital bone directly below the pupil, so you wouldn't find another place. It's just because it's directly underneath the pupil and on the right on the bone. So that's the pressure point.
It's fascinating because Bill's sitting next to us, and he says, "Oh, I think." What did you say?
Right, I got a problem with my shoulder.
He says, "My shoulder hurts," and she says, "No, it's your back, and this is where it's coming from." And you just looked at him and said, "No, this is where it is."
That's how she got me.
Actually, he can practice the acupressure point, like one of the point on your neck, like this is mastoid bone behind your ear, and just below and behind here, it's very, very sore, right?
Yeah.
Yeah, if you press that, you actually loosen up this muscle here, and so that it won't press your nerves. And when it press nerves in the blood vessel, you not only have this shoulder pain, but also it cut off the circulation to your eyes. You can get glaucoma or
She
dry
always
eye.
knows.
When she walked in here, she looked at me, and she sized me up in 5 minutes, and she kept staring at me and said, "Is something wrong?" The first time, I said, "Something wrong with this
She looked
woman."
at your tongue across the room.
Okay, take it easy.
True story?
Yes.
Look, she's still doing it.
I know. That's why we got these bubbles, and I hide behind them.
But it's really amazing. I mean, I was there the other day, and everything hurts. I've got talked about autoimmune inflammatory disease. I have it everywhere, and she goes, "This, yes, this, yes, this, no," and you just know. Dr. Lee is just amazing at what she knows in her diagnosis, how she does it, and then it's always different. Every day is different.
Yeah, our body changes so much. Like every year, I feel the changes. The hormone changes, the muscles. Now my estrogen is dropping, and I'm not so hyper, but my muscle kind of weak.
You're
And
not so
then-
hyper?
I was very hyper.
You
10
were?
years ago.
I don't
Yes.
think she wrote a book today.
She used to write 5 books a week.
You have
No,
a new book
no.
coming out, don't you?
I'm working on the longevity book and eye problems.
What happened to the ED book?
She
The
finished
ED
it.
already published.
Yeah.
So it's in Amazon.com. It's called ED and prostate problem. So
Manuel, yeah.
That'll be next month's topic.
Yeah,
We'll do-
ED books coming
We'll
out.
do ED and prostate problems. Come on, the other book was hormones, but in your spare time you write books. This is how many you've done?
But she's slowing down.
yeah, that's the 4 books. And the book called Chinese Acupuncture and Herbs for Common Disease, and that listed like high cholesterol, weight gain, and excessive sweating. You will be amazed how many people have that issues. That's all related to the nervous system, because
Yes.
when you're not calm, you're hyperactive, your immune system out of balance, and that leads to autoimmune and chronic inflammation. But when you're hyperactive, you can also cause excessive sweating. So they're just sitting there and laughing, and they start to have so much sweat.
Hyperactive and anxiety, are they the same thing?
Yes, it triggers the anxiety.
Triggers, okay.
Yeah. So we have to stay calm and not as hyper as
Yeah.
I was before.
Stomachache from all this.
I know. I'm gonna tell you. If she comes, the whole world.
I've got a little
You know,
anxiety.
it's funny because she used to go to Boston. She used to come out here for a week, and she worked the whole week, 7 days a week. You couldn't get an appointment because everybody was like, "Oh, Dr. Lee's back in town." Now she lives down here. Yes.
Yeah, most
And
of the time.
and so all of that, she I don't know if she did it on purpose. She was building this big incubator because she kept telling us next month, in 2 months,
Yep.
I'll see you. Oh yeah, I'm gonna move down here. So everybody was anticipating. Now that she's finally here, do you still go back to Boston?
Yeah, for a few days to.
Now
have
she's
the other
flipped it.
clinic.
Oh, she's going
Yeah.
tomorrow. How can
Yeah.
people find you? Because you'll be back in a week.
I think the best way to go to the website, Boca Acupuncture, and you can find the problems you want to fix and find the self-healing technique. That's very important to save your money and the time.
Very
It's
cool.
bocaacupuncture.org, from everything from hormones to glaucoma to acute pain, just to rebalancing. I know someone who said, I just need to be rebalanced and rebooted. You should try it, actually.
That's right. For you guys out there, ED problems, she wrote a book on it. Check it
Contact
out.
Dr. Lee. She is on Northwest 9th Avenue in Boca, right near Boca Regional Hospital, so she's
You
very
got that
close.
joke.
Yeah, I'm not going there. I'm going to let
You
you guys
got
have that little conversation in a second. Her phone number is 617-817-1910.